Assalamu alaikum. So dear students, in this lecture we will discuss about a medical condition known as gastroparesis. Gastroparesis is the paralysis of the stomach, or can say is the dysfunction of the motilin receptors or motilating muscles of the stomach. The gastric empty will be lost, or can say the gastric empty will be reduced. The patient will feel full or can feel early satiety, and if the gastric content will not be eliminated, patient will do frequent vomiting, or patient can be present with the constipation, or sometimes with present diarrhea. So this condition is commonly seen in diabetic patients, and there are some other primary and secondary causes. We will discuss about those. So gastroparesis, what is gastroparesis? Gastroparesis is a dysfunction of stomach, or can say it is a paralysis of stomach. The main causes of gastroparesis are, primary causes are idiopathic cause, unknown to us, and the other primary cause, you should not learn these things, idiopathic cause, and there is an hereditary cause, hereditary, but you should remember the main cause. The main cause is, because this disease most common cause is diabetic neuropathy. Mostly diabetic, almost diabetic patient with diabetic neuropathy has this condition, gastroparesis. There are some other drugs like calcium channel blockers, and some diseases like systemic sclerosis and amyloidosis are there, and there is a muscular dysfunction called gastric myotonic dysfunction. These are the conditions, but you should remember only this one. You should not forget that patient with diabetes will represent to you with some symptoms, that undergoing cause will be the gastroparesis. So let's discuss the symptoms. Symptoms are very easy. This patient has a dysfunction of stomach. Patient will not be able to eliminate its gastric content, so the gastric content will eliminate out through its oral route, vomiting, frequent vomiting. And the second condition will be early satiety. Patient will only eat a small amount and will feel full. So the main symptoms will be frequent vomiting and early satiety. But there are some other symptoms. Like constipation, or with also present with diarrhea. These patients also present with diarrhea and dyspepsia and nausea. So these are the, or bloating, sensation of feeling full. These are the symptoms, but the main symptoms will be the early satiety and vomiting. Now discuss about the investigations. You can also do endoscopy or some other test, but you should only remember this. Investigation of choice is scintigraphy. scintigraphy, or in some other books only written as gastric emptying studies. There are other some investigations, like you can also do endoscopy. The main thing is you should remember how to treat this patient. So let's discuss about the treatment. There is a drug known as, drug of choice is metoclopramide, and then with the metoclopramide you should do you should give domperidone. There is an antibiotic we should use, that's antibiotics side effect to treat gastroparesis, and that drug is erythromycin. Erythromycin's side effect is that it increases the motility by stimulating motilin receptors, which will enhance the motility function of stomach. But in severe conditions, these drugs will not be applicable. These drugs will not be functional, because in diabetic neuropathy, especially in diabetic neuropathy, neurons will be damaged or dysfunctional, and patient will not be able to swallow any kind of drugs, any kind of food, because the function of stomach is completely lost. And in that condition, in that time, we use an instrument we use as a pacemaker, or can say as a SA node, known as gastroneurotransmitter, act as a, can say, pacemaker of your stomach or GIT in severe condition. Use as a pacemaker to stimulate, to generate an artificial stimuli to increase the motility, to start the motility function of stomach. So this was gastroparesis.